I think one of the unique aspects of our training program is that we draw from a region known as Hampton Roads. We have individuals with military backgrounds, we have individuals who perhaps have farming backgrounds, we have blue-collar and white-collar workers. And so any given day in your clinic, you're going to see a magnitude of individuals with diverse backgrounds. And having a very heterogeneous background allows you to develop a more diverse skill set in terms of management of specific disease processes.
EVMS has every single subspecialty of ear, nose, and throat represented.
And all of our attendings are also really easy to work with. They're great teachers and mentors.
We're exposed early and often, and all the faculty are very engaging. Getting early exposure is not only helpful in terms of figuring out what you like to do and career planning, but also building those skills, both surgical and clinical.
To me, that was also important because I wanted to realize that at the end of the day, if I decided to subspecialize, I picked a subspecialty because I really knew that I really wanted to do it, as opposed to having a deficiency in our curriculum.
The residents are working directly with the faculty on a daily basis.
Within each rotation, the residents will get to work with all of the faculty. It's a great kind of one-on-one experience. We have about 16 faculty across all the subspecialties and 15 residents. So there's usually one resident, one faculty member together at a time.
They get to know the patients that are being seen. They can see the patients before surgery. They can operate on the patient, and they can see the same patient after surgery.
Hi, I'm Dr. Purpura. I'm one of the residents working with Dr. Dobratz today. What brings you in to see us?
About 4 months ago, I was hit in the face with a football.
With a football? Okay. You're seeing consults, you're seeing patients in the clinic, you're in the operating room. You're really getting all aspects of patient care from day one. As a second year, you start taking call on your own, so you're the only resident in the hospital that's an ENT resident, and you're seeing every single consult by yourself. You always have backup, obviously, but you get pretty confident in being able to talk to patients, figure out what's going on, figuring out what you need to do to take care of that patient.
The residents that graduate from here are always letting us know how they feel so prepared, and when they go off and do their fellowships, how they feel even more prepared than the other fellows around them because of the great training that they've received here and the well-rounded training that they've received here.